All right. Hello, everyone. Hello, hello. We have quite a few people in here. A lot of new faces. Hello, a lot of new names, but
Okay,
new faces are welcome too. This is going to
absolutely.
be this is going to be a participatory event. So I encourage everyone to get comfy. If you can, feel free to turn your cameras on. If you're
Turn my
interested
volume
in
down.
participating in the conversation, feel free. This one is recorded, and we'll be sending out a summary to everyone after the webinar. I want to say thank you so much for joining us in the first place. We really appreciate it. We hold these webinars every month here at Celeritas. We find some of the coolest people we can every month and get them to discuss their passion topics. And this month, I am honored to welcome Mr. Emmett Nance. And uh, Emmett here, I will give a quick introduction to, though I know no one can introduce themselves better than themselves. But Emmett is a leader in veterinary healthcare and technology and the co-founder of Inventory Ally. Emmett's journey is one marked by innovation and a deep understanding of the challenges faced by veterinary professionals. In fact, last month, Emmett celebrated 2 decades in the animal health industry. Whoa. If you know, correct me if I'm wrong, Emmett. Maybe it's 2 decades and some change now.
I knew I was coming up on it. I wasn't tracking it, but
And
well,
look
it's
at
good
that, you
to.
learn something new every day. And from his early days at Banfield to his pivotal roles at SmartFlow and IDEX, he's consistently strived to bridge the gap between technology and veterinary
How many
healthcare.
people are on?
There's tons. We've got a few
Oh,
people here. And I mean, Emmett, I would love to give the mic over to you to kind of describe what we're talking about today. Here's Chandler. He's joining in too.
Hey,
Um,
Chandler.
yeah, let's welcome Emmett, and I'll pass the mic on to you.
Wonderful. Well, thanks so much, Daniel. I appreciate it. And everybody, if you want to turn on your screens, if you want to, stay muted unless you're going to ask questions and stuff. But I love to just have this as a participatory type of engagement. I do have a number of slides to walk through just to help kind of drive the conversation. But we're here for a little while. My primary goal is just to have a conversation so that we can leave the conversation with maybe some additional insights or thoughts that we share with each other on how to make inventory management a little bit easier, get better results. Some of what we're really trying to achieve today is how do we simplify this thing that tends to be a bit of a beast within most hospitals, and it contributes to the second largest expense in the P&L, right? It's what I find oftentimes is it just seems to be overly complicated. It never gets quite optimized. So we're going to tackle how we make this a little bit easier and maybe put some more money in the bottom line, if that's fair. Okay. So please feel free to join me. I might get on a little bit of a roll, but feel free to interrupt me. Say, hey, wait a second. Explain that a little bit more, and we'll dive in. Okay. I will do a quick intro of myself. Daniel, appreciate it. You did do a fantastic job. I won't add too much to that, but I do have about 20 years of experience, mainly in veterinary hospital operations. One of the things I say often is I'm very passionate about the people who are passionate about pets. I find a real kind of geeky passion in solving problems, really process improvement problems. One of my favorite books I recommend it all the time is called The Goal by Ilya Goldratt, and it talks about the theory of constraints. And it's really just in any process, there's a bottleneck. How do you identify it and fix it? And then something else becomes a bottleneck. So you're always looking to make things a little bit easier. I have worked at Banfield by managing hospitals. I was a data analyst, hospital director, business partner. I did some large scale process improvement projects for that entire network over a course of about 12 years. I was the chief operating officer at a product called SmartFlow, which was a startup workflow optimization digital solution that was exited to IDEX, where I spent 3.5 years managing customer success and software implementation for things like Cornerstone, Neo, DB Max, a few other products. I also helped kick off a consolidation group called Galaxy Vets, which is employee stock ownership based design for hospital acquisition so that everybody gets to share in the ownership of that company. But my focus is on Inventory Ally, and that is what I've been working on for the last year. And Inventory Ally is we'll dig into it a little bit more, but it's really about just simplifying, leveraging data to improve inventory replenishment in the hospitals. I also want to introduce just my co-founder at Inventory Ally is Nicole Clausen. Nicole's already recognized as the guru in inventory management throughout the entire industry. She's an influencer, a specialist, a consultant, a coach, and more often I find she's a friend to everybody that she works with. So she's my co-founder. We're both very passionate about just solving inventory issues and helping every hospital simplify the process, get better results, and have what they need to focus on their passion, which is treating pets. Aaron? All right. Well, I'm going to start off with kind of the foundation and the basis of where I come from. And that is that veterinary medicine is a service business. And I say that because the best way to be successful in a service business is to have your customers come back and refer their friends. That's how you grow over time. You create lifetime value by providing exceptional service and care for the patients that come to see you. Right. So my focus becomes on how do we eliminate barriers and bottlenecks, as I want you to focus on patient care, customer success, but there's a lot of manual processes throughout the day within a veterinary hospital that tend to distract from patient care and customer engagement. Those types of things, in my mind, need to be removed or automated. And so that's where we focus a lot of time and attention. And inventory management is one of those things, right? So we want to be able to create solutions and simplify things so that you can focus where it should be. So one thing I want to just kind of touch on here is make sure we're all aligned. I'm going to start with the P&L piece. So today we're going to focus on simplifying inventory management, but a key outcome of simplifying measurement, so measurable outcome, is cost of goods sold. And it results in improvements to EBITDA, or earnings before interest, taxes, depreciation, and amortization, which is just a fancy word for profit before you pay a bunch of other stuff, right? And EBITDA is important because it is the profitability of the hospital, but is also, if any hospital is looking to sell to anybody else, it's the multiplier that it's based on. So any improvements to EBITDA gets multiplied if you're going to sell your business. And so in this example, just taking kind of a static, if you have total revenue, about 20% towards doctor labor, maybe 28% towards support labor, 25% cost of goods, and 15% spent on other things like rent and vendors and all those types of things. Well, that leaves about 12% EBITDA. But if we could improve EBITDA by 5%, what would that mean? Well, if we had a $2.5 million hospital and we increased it by 5%, that's $125,000 per year that's added to the bottom line. And if that hospital is looking to be sold at, say, 10 times their EBITDA, that's another $1.25 million worth of value on that hospital. So this is just one of those measurable outcomes that we can always kind of think about, because we can reinvest some of that profit back into the team, into the facility, into equipment, things to that effect. And also, if the hospital is looking to be acquired, there's a lot more value that can be created by just improving some of the simple processes that contribute to EBITDA. And we're going to focus on that cost of goods component of it today. Does this make sense? Trying to create a bit of a foundation here.
Looking good on my side.
Wonderful. All right. I know I can get on a little bit of I'm just going to go, but again, don't hesitate to pop up. I can't see anybody's faces other than Daniel and Rich. So if you guys have anything, but don't hesitate to jump in here, ask some questions, or offer some perspective if you'd like. So as we decided, we want to dig into cost of goods sold, and that's one of the things that we want to improve. There's other things associated with it. It's not just the financial outcomes of cost of goods and EBITDA. We spend a lot of time managing inventory. There's a lot of frustrations. It's a bottleneck. It's a pain point, and it's a distraction from delivering good service and good medicine. Well, here's a few of the things, right? A lot of hospitals end up with a lot of extra stock because they're really working to try to prevent stockouts, because there's all of these challenges associated with maintaining availability, trying to monitor the cost of the product, tracking what you've used, trying to keep a sense of shrink, things that have been lost or otherwise wasted, and then also keeping track of what's changing as far as your demand. So demand forecasting, are you going to be using more or less of things over time? And what we find is a lot of hospitals are spending like 4 to 12 hours a week trying to keep track of all this stuff, replenish it, make sure they don't run out. Some have a really good handle on things, but those that do actually are spending a lot of time auditing things like PIMS data, adjusting reorder points within their Excel sheets, replenishing their poll tags. They're doing a lot of quite a few things to just try to keep a sense of this and make sure that it's predictable, because the main thing is they don't want to run out. And so they're doing their best with fairly inaccurate or complex opportunities. The other thing that I really want to pull out on this too is those hospitals that are doing well, oftentimes you have an inventory manager who's really come up with some fairly complex ways of keeping it good and maintaining it. But what I often hear from folks like that is it's very hard to take vacation or to be out of the hospital because they're the only ones that can do this. And so taking vacation, being promoted, or pursuing other options becomes quite difficult because it's not a predictable, easy to use process. So we also want to tackle that so that you have the opportunity to grow and succeed and at least take a vacation without being bugged while you're out. Right. So I want to dig in a little bit on some KPIs again to kind of set some of the foundation of what we're trying to improve here. What you'll notice here is I don't have cost of goods on this. Cost of goods to me is, and also referred to as cost of sales sometimes, is the outcome. So it's one of those things that we measure on the outcome of the changes that we make. But the things we're actually trying to measure and improve are these four. That's what we're going to dig into a little bit more. So shrink is the first one I'll talk to. You might hear it as leakage or loss or waste, but it's really anytime you spend money to purchase something that you then don't use or it doesn't generate revenue, right? So think of expiration, theft, discounts, giving things away. There's a variety of different ways that we can use product that doesn't actually produce value, and that's loss. It's not always in the form of revenue. There's a lot of things that we buy and use inside the hospital. Think of simple things like gauze, catheters, but we have a new tech that's not very good at setting catheters. So we go through 10 of them before we set it. Well, 9 of those were waste, maybe for a good reason. We're teaching, we're training and whatnot, but there was no real value outcome there. So cost of carry is the next one. Cost of carry, inventory on hand. It's the value of the inventory on the shelf at any given time. So if you took everything that's on the shelf and you added up the cost of all of that, that's the total value. A lot of hospitals do an end of year or a periodic twice a year, quarterly full inventory count to get a sense of how much is on the shelf. Well, that's what we're talking about here. But it has a lot of opportunity in it. So think of what you would do. We're going to come back to this in a little bit, but think of what you could do in your hospital if you were able to free up 500, 5,000, 20,000, $50,000 just from improving how much inventory is being carried. You could free that cash up and invest it elsewhere, right? Are there capital improvements? Are there updates to your team? Things to that effect that you could do with that. We're going to dig into that. We also talk about margins, right? So margins is the amount of money you make on a product. So it's revenue minus cost. But one thing we're going to dig a little deeper on here is we don't want to forget about the total costs and just focus on the purchase price, right? We need to think about the shipping, the disposal fees, the production fees, a variety of other things that kind of go into the actual cost of the product when we're building our margins, and then making sure we have a strategy around margins. Because once you take out waste and inefficiency, margins becomes one of the biggest opportunities to improve your cost of goods sold and your EBITDA. The last thing we're going to talk about is sales mix. And so this is how, your mix of goods versus service sales and how that impacts your P&L and your opportunity to manage a good hospital and continue to grow, but still keep good profitability in mind, right? So it's really more than just minimizing product cost. We need to dig a little deeper. And the reason I say that specifically is most hospitals try to manage their cost of goods by setting an artificial constraining budget, right? So they're going to spend X amount of dollars to replenish, and that's how they're going to limit their cost of goods. I highly discourage it because it actually exacerbates a lot of the inefficiencies if that number is not set well, okay? Anything I can clarify before I continue moving on here? Am I doing all right, Daniel?
Yeah, and I mean, first off, the shrink part, to start off with that, the amount of conversations I've had, just seeing how certain ways of managing inventory uh and the way human error can get in between that, leading to shrink, like if you have
Yeah,
vaccines go bad, medicines going bad, things like that, because you're ordering too much, or maybe
right.
you're not, like it's sometimes an issue of, yeah, ordering too much and then having to suffer as a result. So I'm glad that you brought that up.
That's exactly right. That's one of the next things we're going to dive into is what causes shrink and how do we start to prevent it? Because you're right. Absolutely. Anybody else on the call? Anything I should clarify or you want to offer some comments or thoughts about before we kind of progress?
Well, I know that you mentioned certain ways of managing inventory. When they dedicate, when these teams will dedicate someone in the role of an inventory manager, and how they
Mhm.
have their specific way of doing things, and they can't take vacation because then who's going to be, who can replicate their system? I'm
Right.
curious if anyone has a funny story of someone's method that they've bared witness to that is a good example of that, because I'm sure there's stories out there. Um, don't be shy if you have one. If not, that's cool too. But anyone in the audience have an interesting story of someone's way of managing inventory? I know Excel
Hey,
comes.
Bree.
Hey, I don't have necessarily a funny story about somebody's way of managing inventory. It's probably my way of managing inventory. It is all in my head and nobody else knows it. And so I can definitely agree with this. I recently went on vacation, January for like the first time. And I had to put my phone in the hotel lockbox the entire trip just so I wouldn't get involved with what was going on. So I completely hear that.
Yeah. Did you get any panic texts or anything like that when you came back to the phone?
Yes, I did because we had a refrigerator. We had a power outage, so we lost refrigeration for a long, long period of time.
Of course you did. Just to
Yeah,
reinforce the idea that you should never take vacation, right? That's kind
exactly.
of just the,
Exactly.
the way things work.
Yes.
I appreciate you sharing that. Yeah, we hear that quite often where people are like, I just can't really take vacation or I can't take a real vacation because it's just so complicated. Yeah. Appreciate you sharing that, Bree. It's good to see you. Any other good examples? Does that resonate with folks? You can use the comments piece too if you don't want to pop on one screen, but I do hear this quite often for sure.
I know I've worked at practices that just use a whiteboard, and that's all they've ever done.
Yep, the want list, the whiteboard, the stock out list. I see them frequently. Absolutely. The one of the problems with that, Rich, is that, and we see it again, we see it often, but that is really essentially, hey, we're already low or we're out. So it's very, I'll talk about it a little bit more in a minute, but it's very reactive ordering, and it's something we see very frequently. So it's really the basis of what we're going to try to improve. We're going to go from reactive to proactive with some of these ideas today. Thanks for sharing. All right. Well, let's just go ahead and dig in. So I kind of presented there's shrink, there's cost of carry, there's margins, and there's sales mix. So I'm going to go a little bit deeper on all four of these. And it's
Hello,
just hello,
this is.
this is Emmett. Who's
Hi.
this? Hi. We're on the webinar. You mean you're trying to? I'm confused. Are you joining us? All right, I'm going to continue. Yeah, I'm going to keep going. That was fun though. All right, so we're going to dig into these four areas and of opportunity, and let's talk about what we can do to make some changes here. So, first thing I just want to say is turnover. That's the first thing we're going to talk about. So, increasing turnover means you're going to replenish things more frequently, And by doing so, you're going to reduce how many units you order and carry at a time, right? So has anybody heard of the phrase just-in-time inventory? That's something JIT, just in time. It's really more of a, go ahead, Daniel.
Yeah, I haven't heard of that one, but it sounds like the
Mhm.
perfect phrase to kind of describe it. It sounds, yeah.
Yeah, just in time is more in the manufacturing type of design, but when you start to dig into some of my background is Lean Six Sigma, which gets very statistical and replenishment and whatnot. And in a manufacturing piece, you can kind of think of I need one of these and 5 of those and 10 of these things to build this thing that I'm building, right? So the math is pretty straightforward. And just-in-time inventory philosophy is really about I need those things to come to the line right when I need them so that I end up with a whole bunch of excess in my warehouse, on my line, taking up space and money. So if it comes in just in time, then I'm also reducing the time from when I bought it to when I sold my product and recouped that cost, right? And so just-in-time ordering is a philosophy there. And the real intent of it actually, though, is you're going to start to push some of those carrying costs. So the cost of buying the product, setting it on the shelf and waiting for it to sell, you're going to push some of those costs back to your suppliers, right? So you want to get into some type of a flow that can enable you to have less on the shelf and have it replenished closer to when you need to consume it, so you don't carry that burden, right? So it's not really as feasible in a service business because of the variability. We have a lot of kind of ups and downs of variability. It's not as predictable as like a manufacturing or even a retail environment, but the concept's still very viable, just at a little different pace, right? So it's not going to show up right when you look to sell it. The actual change is that you ask others to start to carry those costs and get it to you closer to when you're going to consume it. All right, so carrying fewer units actually reduces the opportunity for theft and discounts. So we're going to start to reduce waste by increasing turnover. So Daniel, you started to talk to this a little bit. Right? If we have a whole bunch and then it, for your example, the fridge goes out, or if it sits there for too long, it goes past its expiration date. Right? We find that we have a lot of excess in a lot of our hospitals because one of the things that we see consistently, I talked about reactive ordering. Reactive ordering is really about don't run out, and that's the primary focus we often have. But when we really just focus on that, we build a lot of excess, and with that excess, that's going to see what we start to drive this waste. We have more opportunity for expiration, but we also have more opportunity for theft, discounts, giveaways, a variety of other things that cause us to lose. So by increasing inventory turnover, we're going to reduce the amount that we carry, increase how frequently we replenish it, and that's going to start to actually save us quite a bit on waste. It's also going to increase our working capital. So if you think about all that inventory that's on the shelf, and I mentioned this a minute ago, but if you add up the value of all of that, well, that's money that's been spent, and it's now sitting on your shelf until it gets sold. But if you can reduce how much you're carrying, that money gets actually freed up and can be reinvested. Just a couple of weeks ago, I was actually talking with a hospital that uses Inventory Ally, and they really wanted to invest in a new industrial size washer and dryer for their hospital. But they were really concerned because it was going to be about $20,000. But in the conversation, I was able to show them that based on some of the changes they've made by working with us, they've actually reduced their inventory carry by about $20,000 over the course of a few weeks. And so that money was able to actually be reinvested into an asset, washer and dryer, that was going to meet their needs a whole lot better and free people up to serve the patients more because they're not doing a bunch of small loads in a hospital, in a washer dryer that's not big enough. They'd actually have industrial size strength. So we freed up capital to reinvest. And it was a lot of fun to talk through that. Increasing inventory turnover also requires a predictive, proactive approach. So it's as you shift to a process that enables higher inventory turns, you're going to find that you end up saving hours per week, right? So a lot of hospitals we've worked with are spending somewhere between 4 and even up to 12 hours a week managing their inventory. But as they move towards a proactive approach, they can come down to 30 to 45 minutes once a week, not these daily replenishments. And so as you focus on increasing turnover, you start to reduce waste, free up working capital, and save hours that you can reinvest towards patient and customer care. All right. So I want you guys to just take a minute and let's do some quick math. If you have this information or you know about what it is, I want you to take the total inventory value. Last time you counted it, maybe it was the end of last year, maybe you've done it quarterly or you do it regularly. But if you have a sense of how much inventory you have on hand and the value of that, I want you to divide that by your average monthly revenue, right? We're not looking for exact math, but give us a sense. If you know the value of the inventory on hand and then divide that by your average monthly revenue, gives you a percent. Is anybody willing to share what that percent comes out to? Give me a sense of where you're at. Anybody? Going once, going twice? Maybe you're still working on it. Okay. If there's no volunteers, I'll offer some insights myself, but you can compare against this. And if you have time to go do the math later, you can also get a sense of where you're at. What we find is most hospitals will come out with somewhere between 35 and 45%. And so that means the total value of the inventory on in your hospital is about 35 to 45% of what your average monthly revenue is. But what we find is hospitals that increase their turnover and improve the process drop that to about 20%. Okay, so based on the size of your hospital, you could free up $10, $15, $20,000 or more in what we call working capital, and you can reinvest that into things like the washer and dryer that I talked about there. Cool. Does that make sense? Excellent. So this kind of becomes the foundation of what we're going to build on, because this is where we're going to eliminate the waste. We're going to move from reactive to proactive, and we're going to start to get some turnover that saves us time and money, but it also makes it to where we can start to delegate. So Bree, to your example there, we also start to make it something that others can tackle as well, because we'll add predictability. Okay. So once that process is dialed in, then I'd say it's time to focus on truing up your margins. This is that next iteration of things to continue to improve outcomes and performance. So it's the second largest contributor to poor cost of goods, right? So beyond the waste and the excess cash capital, margins becomes the biggest opportunity. So margins are the difference between the product cost and the amount of revenue you generate from the product, right? And there's lots of strategies, and it'll be very specific to your practice type, whether you're rural versus urban, your type of formulary, your customer base. But regardless, it's important to know that your strategy or what your strategy is, so you can measure against it and then monitor errors, opportunities, and loss, right? So I'm not going to give you a specific strategy on what your margins should look like because of all those variables, but we'll walk through how you might be able to get there and what data you can start to use in order to start to calculate some of this. The most important part is that you do end up with a strategy so that you can start to implement it and monitor against it. All right, so one thing that we see a lot is that you're going to set targets by category. Right? So you're going to consider items that are you're also going to consider items that are like easily compared to online and competitors. So we call them shoppable items, right? Those things that I can kind of call around for, I can go online. You're going to want to consider those and most likely be somewhat competitive as it's appropriate to your brand. Mm-hmm. But you're also I recommend considering the convenience fee. If I have to go online to order it, I have to wait a day or two for it to be delivered, and it's inconvenient for a lower price. You are actually already paid for it, you're carrying it. So I always recommend that on top of your margin, you include the idea of the convenience fee, because you have it right there and it's easy to access. You have a cost that's associated with making that product available, and so charge for it. Also, don't forget to account for all the product costs before you start to set your margins, right? There's what you paid for the product, but there's also shipping costs sometimes. There's also fees associated with disposing, whether it's of the boxes or, or controlled substance wasting, those types of things, and sharps, right? So you have disposal fees. And then don't forget production. It's something that's overlooked. My co-founder, Nicole, talks about this sometimes, but the idea that you are paying production also is part of the cost. So just imagine if you take a product and you're marking it up, just for round numbers, you mark it up 50%, but then you pay commission that's 25%. Well, you actually only capturing about 12.5% margin, right? So if you pay $1 for something, you mark it up 50%, so you charge $1.50, and then you give a 25% commission on that $1.50, which is actually 37.5 cents. You're left with 12.5 cents profit on that product that you spend $1 on. So always keep in mind that you've got multiple costs that go into the product, and use that cost total to then build your margins on, so you can hit the targets that you're shooting for. That's a very easy way to lose margin and increase your cost of goods without quite knowing why. Okay. The third piece here is online pharmacy. Really what I'm talking about here is don't carry items or just carry them in small amounts if they're slow moving items. I talk to a lot of hospitals that carry a lot of stuff just in case. That really inflates your cost of carry. It increases your opportunity for shrink, and it becomes very wasteful. So in my opinion, a big opportunity is like within food diets and parasiticides. You've also got a number of other pharmaceuticals that would apply to this. But those items that you don't really sell much of, but you're just carrying them just in case, really look for an online pharmacy type of option, right? Offer them there, because in addition to saving the carrying costs and the frustration of replenishing and all that type of stuff, you can actually increase the total amount of SKUs you offer in an online pharmacy option, right? So you can start to generate more revenue and different streams there, but you're also, from the perspective of inventory management, it's a great way to start to decrease the complexity within the hospital. So I really encourage slow moving inventory, and even things like recurring prescriptions are really good for online pharmacy to increase some of your revenue generation. Okay. Am I being coherent, Daniel? Just going to do a check-in here as I work through these things. Is it making sense?
You're perfect. And I'm glad that you added online pharmacies to the mix, because I think that that's something often overlooked. And in a post-COVID world, I really do think that we have more of a need for online accessibility, even if it's even beyond just slow-moving inventory. I think that an online pharmacy, having one set up and managed well, is integral for clinics. So I'm glad that you mentioned that.
Absolutely. A great point there. And I'll just tie it back to what I said at the very beginning too. In my mind, veterinary hospitals are service businesses, right? And so you're delivering that value, that lifetime value creation of those customers coming back. The service, the medicine that you provide cannot be distributed online. I know there's oftentimes fears about losing some of their margin capabilities and your profit capabilities to online providers. But when you partner with the right ones, they can actually increase your total capacity, and they can augment your ability to provide good service and quality medicine without having to be experts at a bunch of other stuff. And I'm actually going to come back to some of that in a little bit about some of your supplier interactions and leveraging those relationships.
And Erica just left a good comment that says, what would you consider slow moving? Just set up online pharmacy and trying to evaluate items now. And congrats on that, Erica. Yeah, Emmett, what would you consider slow moving?
Yeah, excellent. So it's going to be items that you replenish infrequently. It depends on the hospital. So I'll go into a couple things. There's data that you can use, but there's also some, I'll just call it gut feel, right? Or some subjective insights. But those things, if you're carrying them because you think that they might sell, or you want to have them there just in case, that's where I start. Those are really good items to say, hey, I have that. You can go online and I'll have it shipped directly to your house. One exception to that might be, for emergencies, things of urgent case that you still might not use often, but you should carry enough, probably for an instance, right? Like if that happened, I need this much most likely, and then I can get them some additional online by just publishing it there. Slow moving inventory, if you use data, it's going to be items that you carry that sit on the shelf on average for more than, say, 3 months, would be definitely a slow moving item. So if you're going through and replenishing things and you don't have to replenish something for more than 3 months, So maybe every 4, 6, or even 12 months that you have to replace that I'd definitely consider a slow moving product. That answer the question? Excellent. Going to assume yes, but let me know otherwise. Okay, so moving into the third piece. So we've talked about shrink and cost of carry. We talked about margins and getting a bit of a sense and structure there, and we'll come back to a little bit more detail. But we're going to move into kind of what's the idea around optimizing your sales mix. And it's really quite simple, right? The main reason emergency and urgent care facilities, for example, run much lower cost of goods sold than general practice and large animal hospitals is because their service revenue is so much higher, right? So how can you increase service sales that do not depend on goods sales or use low cost goods? So according to some data from KSM Consulting, professional service revenue actually carries a 9% cost of goods in the best hospitals and about a 10% cost in the average hospital. Whereas your pharmacy items or your inventory sales run a 35 to 40% cost on average. So this means you can make 90% margin on services sold and about a 60% margin on goods sold on average. So for every dollar of service we sell, you make more money, more profit that contributes back to the operations of the hospital. So when we can measure cost of goods sold, we measure the total cost of products purchased, like within a month, and we measure that against the total revenue generated, whether it was goods or service revenue, right? So if we can increase the portion of revenue generated by services, then we can increase our profitability or our EBITDA. So in this scenario I have on the screen, let's assume we're generating a total of $170,000 of revenue in a month, $45,000 of it from goods sales, and about $125,000 from service sales. And if we're running a 25% cost of goods, that's about $42,500 in the cost of the goods, leaving a gross margin of $127,500. But if we shifted that, so we kept goods revenue at $45,000, but we increased our service revenue to $175,000 or increased it by 50, we'd expect our cost of goods to go up by that 9 to 10% that I talked about before on service revenue. So our cost of goods goes up to $47,000 on a total of $220,000 of revenue. Well, now our cost of goods actually dropped to 21.3% from 25%. So simply by changing the mix of our revenue generation, we can decrease our cost of goods, which increases our profitability. Okay. So how do we improve service sales? How can we actually do that? Well, think about the kinds of offerings that would qualify here. So to achieve it at volume, personally, I recommend focusing on preventive care type services. So dental cleanings, preventative digital x-rays, spays, neuters, comprehensive exams. Those are all good examples of services that generate revenue without associated high cost of goods sold. So if you're using something like a wellness plan or membership program, those become really good opportunities to start to drive this type of a service offering. High service, low cost goods, but in a recurring and high volume type of engagement. Does that make sense? Is that something that starts to resonate? Is there anybody on the call that's done this in the past and kind of shifted some of their focus on what they're offering, or even done some promotional type of things like Dental Month and things to that effect that can drive these types of services? Anything you've had success with? Does anybody have any other ideas of what service sales offerings you might think about? Anything that's coming to mind that would fit into this type of category? I can't see the comments, Daniel, so if anything pops up there, let me know.
Yeah, sure. Right now I'm just seeing, injections from Grace Wu. And I know Grace left a very helpful comment for Erica, kind of helping answer the question about slow moving products. For example, she mentioned chloramphenicol, which I'm probably butchering the name of. for example, usually is a further down the line med after a few diagnostics. So you can wait to order as needed if you can find it in a small enough quantity bottle. Chronic refills like thyroid meds can go to your online. And if your flea tick is seasonally driven.
Mhm.
And Erica said, thank you. We have historically carried everything, and it is hard getting DVMs to part with some of the large variety.
Mhm. Yeah, thanks for sharing that. That's something we run into a lot. DVM preference, put it that way. And so having variety of options, having them all on there. But one thing that you'll want to lean into is to start to use data. So there's ways that we can start to collect data and provide insights that can help with those conversations, right? So you don't always need every size of your thyroid meds. Sometimes they can be dispensed otherwise. And how do you move some of those slow moving? And when you think flea tick parasiticides, I see multiple brands with multiple SKUs for different sizes. And so you end up carrying a whole lot of inventory to try to make all those offerings, and that actually becomes quite prohibitive. So great call outs there. Hey, Bree.
Yeah.
Hey, yeah, I'm not sure if this is what you're referring to in this, but recently we were realizing that we had a decrease in our number of feline spays over a course of time. So we went back and reevaluated the cost of that. And we did decrease the cost of our spays in order to provide more of them. So that would, so that hopefully we'd be generating more revenue in that realm. Just by looking at our pricing to see if we were pricing ourselves out of some people coming in for that service.
That's a really good example, both on the margin side, where I was talking more products, but that's on the service side and the margin there. But that's a trade-off of volume versus margin. And that's a really good example of how you actually increase the total dollars you can make, probably on the same size of team, right? You didn't add any labor cost to that. You actually increase the total revenue you can generate through service sales, because it's a fairly low cost associated with that type of offering. So you increase total dollars on what I generally refer to as a fixed cost of labor. When you have a doctor, 2 technicians, a CSR, kind of a unit of cost there, you can increase your total revenue through that type of a strategy. Fantastic job. Yeah, and you probably are seeing far more procedures with the same costs, right? So you generate more revenue. Yeah, great example. And that is a good example of service revenue. So it's definitely fit within this type of a philosophy as well. Okay. So how do you get started? I've talked kind of at high level. There's things that you need to do. You need to increase your inventory turnover. You need to improve your margins. You need to consider your sales mix, right? These are things that are big contributors to your actual cost of goods and time spent managing inventory. So Walt Disney has a great quote here. The way to get started is to quit talking and start doing. So how do we start doing? First thing I want you to do is really think about changing the process. Stop ordering reactively. So Rich, in the beginning, you talked about the whiteboards and the want lists and the stock out reports. Those types of things are examples of reactively ordering, where you're going, what do I need to do? And most of the time I see that on a daily basis. So that adds up over the course of the week. That's like that 4 to 12 hours I was talking about. But it's also stress. It's frustration, because most of the time we have technicians and CSRs who are actually doing the inventory replenishment, and they've got other things to do. And so reactively ordering every day is wasting a lot of time and effort and money. So what we want to do to change the process is prioritize items for replenishment and then determine reorder points. All right, we're going to shift to a data-driven, proactive management. It's going to take a little bit of work. But to achieve this, one of the first things you have to do is assign replenishment cycles. So high cost, high volume items, you actually want to turn those over more, like every week or every 2 weeks. And then other things you only need to replenish every 4 or 12 weeks. Those are low cost, low volume items. And then things beyond the 12 weeks, like I mentioned, if you're going to replenish them less frequently than every 12 weeks, consider the online option. I might recommend reaching out to Nicole. Nicole's got a really good ABC analysis that helps you get started with this. So it helps prioritize your items. A is being replenished more frequently, C's less frequently. And then Inventory Ally, the system we use, actually does this automatically for you. So it'll prioritize and it'll reprioritize items or recommend those reprioritizations to always keep things kind of turning over at a SKU level, at a specific product level, to meet your demands, right? But the next thing you have to do once you've assigned those replenishments is you have to calculate reorder points. So if you're going to replenish, let's say Apoquel every 2 weeks, then you need to set the reorder points to be how much do you usually use in 2 weeks, plus enough that you're going to carry just to absorb some of your variability. So this can be done within, a lot of times you can do it within your PIMS. I know a lot of people use Excel sheets to kind of calculate these on a somewhat like a quarterly basis and then update those replenishments. But we also, we'll talk about that again a little bit, the Inventory Ally. We recalculate those for every product every week based on changes in demand. And we start to guide the replenishment to make sure you have enough and not too much, because that's your goal when it comes to this process piece, is making sure you replenish it in a predictable fashion that optimizes your time and your inventory carry. And then for every product, making sure you have enough, but not too much. Okay, so that's going to be that process piece. Then the second level, once you've got that in, I recommend then diving into your margins. And there's lots of different things. There's resources out there that can give us some insights as to margin strategy. And like I said before, it varies a little bit based on the type of hospital you are, where you're at, what type of brand you are. Are you a low cost? Are you a high cost type of offering, high value offering? But you put together a pricing strategy and then measure your products against that strategy. Right? KSM is a consulting firm on the accounting side, and they actually have some recommendations like mark your vaccines up 4x, your fluids 10x, mortuary costs 1.2x. They don't want to make that a cost burden in kind of engagement, right? Your injections 4x, but parasiticides be competitive. There's lots, like I said, lots of different strategies, lots of different options. But the most important part is you put together a strategy that says, this is what we want to do. You adjust your pricing. Keep in mind, again, the costs that we talked about before and making sure you know what the total cost is. But then apply these margins and then revisit that every 6 months or so, right? So update, are we getting the returns that we want? Is the value being created like we want? This is, again, something that Nicole's really good at helping with. She can offer some consultation to dive in and offer some suggestions. We also provide some data and insights in the Inventory Ally side that might be able to help build some of this. But that third piece that we talked about, and the last thing that we chatted about, is your sales mix. And I recommend doing it like this. Change the process, let it simmer. Update your margins, let it simmer. And then adjust your sales mix and then let that simmer and see what the impact is of each of these modified and incremental improvements to your inventory management and cost of goods strategy. Because what you'll see over time, and this might be a 1-year project, maybe it's a 6-month project, but you want to see this incrementally over time, and you're restructuring the way inventory starts to provide value to your customers and to your business. Okay. So I'm going to touch base real quick on a couple of the last slides. And one is I'm going to talk about leveraging technology and partnerships. Again, your job primarily is provide exceptional care and service to your customers and your patients. So partner with those that with the technology and the partnerships that you can, to let them be experts at things that can complement you and make you succeed long term. All right. So PIMS. PIMS is not a great place to manage inventory, simply because it doesn't account for all of your inventory. A lot of white goods and other consumables don't transact, and therefore they're not recognized by the PIMS. So we see that oftentimes that becomes a difficult place, and you spend a lot of time auditing that data. But PIMS is your transactional tool. And so making sure you update the costs anytime your product costs go up, make sure you keep those updated every week in your PIMS, and then make sure you have automated pricing. So your margins are automatically going to increase as the cost of the product increases, right? That becomes a really big opportunity for margin loss or margin erosion when you don't maintain those costs against that strategy you put together. Suppliers are fantastic partners, right? They want you to succeed because that means that they succeed. So leverage your sales reps to gain insights and brainstorm about solutions. Leverage buying groups. They can provide some fantastic advantages with product discounts, practice consultants, education, those types of things, and access to key opinion leaders. So really engage and leverage your partners to take on some of the complexity and the frustrations. Keep in mind your online pharmacy. It's a wonderful place to reduce complexity and increase your revenue. And also consider things like cabinets. Inventory cabinets are great for things like controlled substance management monitoring. I highly recommend the tabletop solutions for controlled substance management versus the big cabinets. But you can also, they're good for products that are high risk for theft or shrink. So you lock them up. They're also good for items that don't always hit the invoice, but they should, because the cabinets can make sure that it hits the invoice. So really good set of tools here that can start to increase your inventory management, simplify it, provide additional insights, and make sure you're not losing those margins. I'm going to also touch on Inventory Ally. Obviously, I have a passion for this, but we've really built a phenomenal tool to automate a lot of that process improvement component, that step one, if you will. So it integrates with suppliers and PIMs. It automatically creates cycle counts and reorder points. And it gives you the ability to start to customize it by merging items, customizing safety stock, and it provides some very detailed analytics, right? So it monitors changes to price, time spent on inventory management, some of your order details and inventory value on hand. So it gives you that ability to dig a little deeper and monitor things, as well as automate a lot of what you need to do to improve your replenishment process. Okay, so I know I'm coming up on my time. I didn't think I'd go for a full hour just talking here. I thought I'd have more time for questions. But just to kind of summarize here, right? Cost of goods is the second largest expense on the P&L, right? It's robbing you of time and money, and most people just think it's hard, and it's always going to be hard. I want you to take away from this that there may be some effort to get it set up, but it can be a very predictable and simplified process, and it's worth putting the time and effort into. Right? Shift from being reactive to being proactive, and really start to think about how can I leverage data to tell me what I should be replenishing versus reacting to I'm low or I think I know what I need. And the last one I put here is just the golden rule, right? One thing I talk to is don't just focus on the cost of the product. Build partnerships, build relationships. And I ask you to think about the way that you engage your customers. If they're just looking for low cost, you're not able to provide best value. There's a lot of intangible value that comes from partnerships and relationships. And I want to reinforce that that's really something you should do. Leverage the expertise of your partners as best fits your needs and build an ecosystem that allows you to be very successful long-term as a service business, right? So those are the 3 takeaways I'd like you to think about. And I'll open up for questions. And just keep in mind if there's anything we can do to help. We're here to do so. Okay.
Thank you so much, Emmett. And I know in the comments, Bree was mentioning in regards back to the online pharmacy and the shift to online pharmacies. I know that was a big topic, and Bree mentioned ABC analysis has been super helpful for me when it comes to figuring out what to shift to my online pharmacy. So I'm curious if anyone has any thoughts on that. If anyone has any questions for Emmett, feel free to just call out or type it in the chat. I'm so glad that, oh, thank you. This was very informative. Thank you, Nicole. Thank you for joining. And it's nice to meet you all. I know we didn't have time in the beginning. Oh, thank you for putting that up, Emmett. Let me paste some links here for everyone so we can all stay in touch. I have Emmett's LinkedIn. I have Inventory Ally's website. I have my personal LinkedIn, my company Celeritas's website. And so I'm going to post that in the chat right now. So we can all stay connected after this. And I know for me personally, the questions come as soon as I get off, you know, and I go, I wish I asked that before. So I'm sure Emmett's happy to receive your messages and questions after this. I know I am on my side. I'm very glad you were all able to join. Emmett is so thankful that you were able to dedicate your time and speak to everyone here.
Thanks, Daniel. I really appreciate the opportunity. And hopefully you guys are able to take away some at least thought-provoking ideas from today's call. And yeah, if there's anything that we can do to help, keep Nicole and I in mind. We've got a really strong team that's just really trying to help you be successful. So anything we can do to do that, just keep us in mind. Appreciate it.
And look
Thanks,
at
Daniel.
this. We have the inventory savings calculator in the chat. And this is, I can just imagine what a cool tool this is. I'm going to have to open this up on my browser right now. I know we, oh, look at this. It's interactive. Okay. That's a fun one. Everyone, you're going to want to check out the link that Galina just put in the chat. I know we were off to a very quick start as soon as everyone got it on. I know we're not entirely introduced yet. Emmett, are you seeing familiar faces on the call today? Or
I
familiar?
certainly know. I certainly know Bree and Gleena, and I've got to look. And Nicole, how you doing?
Hello.
But I haven't scrolled through. Let's see.
Look at this. I'm seeing new names on my side. So I mean, if anyone wants to introduce themselves before we head out, it's nice to meet you all. And yeah, I'm seeing a lot of new faces. So if you want to reach out here, introduce yourself quick, or if you want to reach out over LinkedIn, feel free. Hi, Tracy. There you are. We're seeing some faces now, maybe some shy people. We'll turn off the recording now, and I'll just say thank you to everyone who did join. And we'll see you next month.